Good afternoon. Thank you all for joining us for today's COVID-19 update for Newfoundland and Labrador. First, congratulations to the Canadian women's soccer team. What a historic day. I know we were all on pins and needles watching it, and what a great day for Canada. Go Canada, go. I'm happy to share today that we are moving towards lifting the mask mandate, which will be essentially for everybody if they so choose to do, on Tuesday, August 10th at 12:01 a.m. This is a big day for Newfoundland and Labrador, and I know it comes with some anxieties and some fears, but the epidemiology supports it, the rates of vaccines support it, and it is the right move for the right time. That said, if you're still comfortable and want to wear masks, then you certainly should. This is about protecting the communities and protecting yourselves, and if you choose to make that decision, then that's certainly something that you should be able to do, and we would support it. Of course, the other thing to help alleviate your fears is that, like all the decisions that we have made in COVID-19, they are not static. They are dynamic, and we recognize that this is a fluid situation, and if the epidemiology changes, if the variants of concern change, then we will change with it, and that could include measures like reintroducing mandatory masks in indoor environments. So with that, I will turn things now over to Dr. Fitzgerald for today's update, which will be a good one.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the last media advisory, we have 2 new confirmed cases of COVID-19 in the province. Both of these are individuals over the age of 70, and both are related to travel. The total number of cases in our province is now 1,443. And there's been 1 new recovery since yesterday in Eastern Health, leaving 7 active cases in the province. There are 2 hospitalizations associated with COVID-19, and a total of 263,991 people have been tested, tests have been completed to date. So it's been just over a month since we lifted the travel restrictions and permitted non-essential travel into the province, and we continue to see sustained low case counts, with only 8 reported cases in that time frame. This, of course, does not include the cases that were on the vessels that were rerouted to the province due to illness on board. So while our region is seeing low numbers of COVID cases, several Canadian provinces are beginning to see increases. 5,703 new cases were reported in Canada between July 27th and August the 2nd, which is a 60% increase from the previous week, and all indications are that a 4th wave will be starting in Canada. However, how this unfolds in the weeks and months ahead depends largely on vaccination rates. The Delta variant is certainly a force in the 4th wave, and it's becoming a dominant circulating strain of COVID, and it accounts for more than 76% of all samples that are tested at the National Microbiology, or that are undergo whole genome sequencing, and 99% of all new cases in the UK and 82% of new cases in the US. What we know about Delta is that it spreads more effectively than the original COVID strain and is more likely to cause severe illness. Jurisdictions are reporting rapid spread of the virus in under-vaccinated populations and regions. In public health circles, this is now being referred to as the pandemic of the unvaccinated. Since Canada began administering COVID-19 vaccines, almost 90% of cases reported to the Public Health Agency of Canada in those 12 and older were in unvaccinated individuals. So our best defense against seeing a 4th wave here in Newfoundland and Labrador is getting more people fully vaccinated. Having 1 dose offers some protection, but 2 doses provides the best protection by significantly reducing the risk of severe illness, hospitalization, and death due to COVID-19. And it also helps to prevent the spread. As of August 5th, we have 60% of our eligible population vaccinated with 2 doses, and the percentage of eligible population with a 1st dose is at 84%. We are hopeful that we can achieve that same number fully vaccinated. Ideally, we need to get that number even a little bit higher, in the range of 85 to 88%, and we need to get there as quickly as we can. The more people we have vaccinated, the better our barrier will be against COVID-19. Modeling suggests that every percentage increase in the proportion of people fully vaccinated can have an impact on the size of a 4th wave and reduce the risk of overwhelming our healthcare system. Your choice to be vaccinated will make a difference. If you had not yet had your first dose, or if you are eligible for your second dose, please take that step and find an appointment or walk-in clinic. You can find availability on our website, on your Regional Health Authority website, or by checking with pharmacies or physicians in your area. Please get the vaccine offered to you. It is safe and effective to have a different vaccine for your second dose. It takes so little of your time to be vaccinated, and in return, you will receive substantial protection for yourself and those around you. Please think of your friends, loved ones, and all those in your community who are not yet eligible for a vaccine. We want to have all children back in school in September, businesses open, and life relatively back to normal. And this can only happen if we can control the spread of COVID-19. We have said from day one that the only way through this is by working together, and that still holds true 17 months later. The sooner we can have everyone on board and protected, the sooner we can lift more public health restrictions and potentially move to alert level 1. In keeping with this goal, we will be easing more more measures effective 12:01 a.m. Tuesday, August 10th. Indoor gatherings are now permitted for up to 500, or will be permitted for up to 500 individuals with physical distancing, and the special measures orders requiring masks in indoor public spaces will be amended so that masks will no longer be mandatory in most indoor public spaces, such as restaurants, stores, gyms, personal services, and performance venues. Masking will continue to be mandatory in congregate living facilities for seniors and in Regional Health Authority facilities. Some businesses may also choose to maintain the mask requirement based on their own COVID policies. And while not required in most public indoor spaces, masking is still strongly recommended, especially when you are not always able to physically distance from others and you don't know their vaccination status. Please be kind and do not judge somebody who continues to wear a mask to protect themselves and others. As we navigate life with COVID and approach another flu season, there may be times when the risk of respiratory illness is higher, and we may recommend taking extra precautions. As always, we will respond based on where the science leads us. For now, the most important thing that everyone can do to help bring this pandemic to an end is to be vaccinated. This is our safest way out, and every dose matters. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and thank you for that sound advice. The best protection against a fourth wave, or the way to turn a fourth wave into a ripple, is to get vaccinated. So please, everyone, continue with the good efforts to get vaccinated. I'll turn things over now to Minister Haggie for some brief comments.
Thank you very much, Premier. It is another step in the direction towards our new normal. 84% with dose 1 and 60% with dose 2 are good landmarks on that road ahead. The best protection for those who cannot get vaccinated is that those who can do so. And I would refer you back to Dr. Fitzgerald's comments about this now becoming a pandemic of the unvaccinated. We have, like other jurisdictions in Canada, a relative gap in the 20 to 39-year-olds, and we would encourage them to take the opportunity to avail of clinics nearby. There will be pop-up clinics that are happening in Eastern Health. There have been some in other jurisdictions as well across the island and into Labrador, and I would encourage anybody who is there and feels that they don't want to make a special effort, but we're kind of coming to you to try and encourage that to happen. I took our Federal Minister of Health today, Minister Haidu, to see the Village Mall Clinic in action, and she was very impressed. It's a smooth, efficient machine from the guys at Paladin Security, who have a way of easing worries for people who are anxious, all the way through to the clerical staff who have made that such a smooth process, to the nursing staff and paramedics and others who've been involved in the vaccination. She was very impressed, and again, it's an opportunity for me to thank all of you. So with that, again, the important thing is get your shot, keep yourself safe, but in doing that, you keep everybody safe. Thank you, Premier.
Thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 1 media member in person and 3 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Dr. Fitzgerald, I'm wondering if you could explain the timing around dropping the mandatory masks. You talked about a 4th wave is happening right now in some other provinces. Considering that's happening and there are still groups that aren't able to get vaccinated, why does it make sense now to drop mandatory masks?
So what we're looking at with the masking really is our own epidemiology, and right now that is quite favorable. And the epidemiology elsewhere really influences some of those other special measures orders we have, like our travel restrictions and things like that. So, so when we're talking about mandatory masking, of course, that means that it is, under the legislation, it's required by law. And when you're bringing in any of these special measures orders, you have to meet a certain legal requirement as well, and that has to be that it's the least intrusive means possible to be able to accomplish the mitigation that you need to accomplish. And I think certainly we know that people here in the province are quite accepting of masks, and that the majority of people would use masks. We saw very little resistance to using masks, and we expect that will continue. And in fact, in other jurisdictions where they have taken away the mask mandates, there are still significant numbers in the range of 80 to 90% of people who report still using their mask on a regular basis when they're out in public. So I anticipate that people will continue to use the mask. We recommend that people do. It's just the question of whether it meets that legal test of requirement.
And I want to ask about the cases that we've seen over the last couple of weeks, because we've started to see travel-related cases. Can you give us a sense overall, are these people who are unvaccinated? Like you said, nationally 90% of the cases are. And because people no longer have to isolate for those first 14 days, how many contacts are we seeing if these are people who were vaccinated and had been out in the community before they tested positive?
So we haven't had very many, and so it's difficult to say. I think certainly there were some incompletely vaccinated people, and I think we've had some who were unvaccinated. The numbers are small, so I can't really speak to really small numbers, but we certainly are seeing that same trend. I think that it's unvaccinated or incompletely vaccinated or not yet fully vaccinated. And for the most part, the contacts are not huge, but certainly at this point, we're not seeing any strain on the ability to be able to contact people. We have had some very low risk situations. We had an advisory for A&W in Stephenville last week, but these were low risk situations for the most part, and it's really just about making sure that out of an abundance of caution that people get tested. So
thank you.
We will now go to the phones. Our next question is from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. The Federal Minister of Health today made an interesting comment about the interconnectivity of the country, sitting on a plane with someone from Alberta coming back home. She said that in the context of condemning Alberta's decision to drop isolation and testing measures. At what point would this province reconsider its travel restrictions with respect to Alberta?
Sorry, could you just repeat the last piece, Peter?
At what point would this province reconsider its travel restrictions with respect to Alberta specifically?
Well, Dr. Fitzgerald and her team are continuously monitoring the epidemiology throughout the country, and if we see outbreaks occur, especially with respect to variants of concern, then we'll adjust accordingly. But right now, the epidemiology is supportive, and we still, of course, had the border tracking in place. And again, encouraging vaccines, and hopefully that vaccination rates can continue to improve throughout the rest of the country. But it will certainly, as we see our rates increase, will certainly protect our community here and our communities here.
Thank you. And Dr. Fitzgerald, you just talked about masks. I'm seeing online in particular, a lot of people expressing grave concerns about it. How would you dissuade someone's concern that this virus might be easily sent into overdrive again with not quite enough people vaccinated?
So I think, the most important thing we've got to remember is that you can still choose to wear a mask if you want to, and we are certainly encouraging people to do that. And even before we brought in the masking rule, there were people who wore their masks, and there were businesses that required that. So I think those sorts of things can still continue. We're watching the epidemiology very closely. We know that, it'll be important for people if they have symptoms to make sure they get out and get tested. That's a very important part of controlling the spread of COVID as we move into the fall, and making sure that we have that people understand the importance of continuing to get tested and not just to assume that it's a cold or flu or something like that. And so if we can find the cases, we can contact trace them. And, we have our wastewater testing now that we're developing a strategy for and hoping to expand as we move into the fall as well. So we do have some surveillance plans in place to be looking for COVID and to find as many cases as we can. But the other thing we have to remember is that as vaccination rates increase and as we see more, and certainly, if we can get to that 85% mark, the risk of COVID causing severe disease, the risk of COVID spreading, quickly, even the Delta variant, are much lower when you have those high rates of vaccination. So we all have it within our power to make sure that we're protected as much as possible by choosing to get a vaccine.
Thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. With regard to school, as of now, and with regard to school in September, what will be the guidance for kids who are 12 and over who have not been vaccinated, as well as children under 12 who cannot be?
I think the Department of Education and Minister Osborne will, in conjunction with Dr. Fitzgerald's team, announce the back-to-school plan shortly.
Okay, and I'm just wondering with regard to masking again, you've mentioned that at times, depending on, for example, the Delta variant right now and other unforeseen, circumstances that could come up regarding the fourth wave, do you foresee masks being part of general guidance whenever there is flu season, for example? I mean, could that be part of just the general outside of COVID-19? An advisory that masks should be worn when the flu and the cold season comes along?
Yeah, so we've talked about this before, and basically, I think our thoughts on masking have changed, and the value of what we see masking being able to do has changed a bit throughout this pandemic. So I don't know that, we may make recommendations. There wouldn't be mandatory masking in those situations for the most part, I wouldn't imagine, but we'll certainly could make recommendations in that regard if we start to see that there's flu going through the community quite rapidly or something along those lines, or in long-term care facilities, personal care homes, those sorts of situations where, there may be people who are more vulnerable and at higher risk. So masking will certainly be something, I think, that will factor into some of those plans as time goes on. But, with regard to influenza, of course, the flu shot is still your most important means of defense. So I have to get a plug in for that too.
Thank you.
Take-home message, vaccines are good.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi there, thank you. My first question is about the mask mandate. Will businesses be able to specifically require masks within their own establishments after the mandate is dropped?
As Dr. Fitzgerald has alluded to, it's certainly within the business's prerogative to determine if that's part of their business or not. They can make their own decisions, but it won't be, as Dr. Fitzgerald suggested, legally required and legally mandated. But just so you see the no shirt, no socks, no shirt, no shoes, no service. I'm sure there will be some businesses who adapt that for masks.
Thank you. And my next question is, as the importance of getting vaccinated is abundantly clear here, will we see more pop-up vaccination clinics like the one at the Village Mall today? Will they become a regular occurrence?
The short answer is yes. They've happened in other areas outside of Metro, but we want to try and find ways to reach those people who really feel it's a little bit more of an effort than they want to make to go online and make an appointment or that kind of thing. So we've got a couple of other ideas we might end up trying as well, such as maybe even door-to-door for some communities, if that seems to make sense. We're not close to any idea, but pop-ups are a good one for sure.
Thank you.
I'll now go back through each reporter to see if you have one final question. Peter Cowan with CBC. Do you have a final question?
I do. We saw from the federal government yesterday that they're at least looking at making vaccines mandatory for federal civil servants. Is that being examined for provincial civil servants? And what would you say to people who are concerned that their kid's teacher or the nurse looking after their parents in the hospital may have made the decision to not get a flu shot or a COVID-19 shot and are now putting their loved ones at greater risk?
Yes, certainly that's something that we're monitoring and thinking about. But with rates approaching 85% today and hopefully even higher, that becomes less of a concern, obviously. But it is something that we're contemplating. For example, in the medical profession, you can't practice medicine in certain environments without certain vaccines. You can't get into medical school without certain vaccines. So it's not a foreign concept, but it's certainly something that we're hopeful not to have to legally mandate because our vaccine numbers are so high. But it's certainly something that we're looking at, and we've heard the opinions on it and heard the voices on it, especially when it comes to I believe the CMA even expressed an opinion about it this week, and it's certainly something that we're monitoring and looking for. But with rates of vaccine, approaching 85% and still a month away from school, we're quite hopeful that we can get even higher, and that would afford the barrier that's necessary, even if there is one or two that don't get vaccinated, or even if there is a couple that, frankly, we know that the vaccine isn't 100% efficacious. So the fact that's when the trigger of herd immunity actually makes a whole lot of sense. So it is something that we're looking at and monitoring, but certainly it's something that we're not moving towards mandating at this particular moment in time.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yes, I do. Just a quick one. I'm wondering, Dr. Fitzgerald, if you could give us a sneak peek at whether choral singing in communities and schools, etc., might return more or less to normal this fall.
So our goal, from a public health point of view, we recognize the importance of school to kids and the importance of it to their overall well-being. So our goal is to get kids back to school to as normal environment as possible, and that includes normal activities. So that's where we hope to be, and I think with regard to choral singing in general, again, with good vaccination rates and good uptake of the vaccine, I think that those things will be able to proceed.
Thank you.
Brian Callahan with BOCM. Do you have a final question?
Yes, thank you. Dr. Haggie, I have to ask you what you make of the negative reaction to your comment regarding welcome baskets and that sort of thing that could contribute to retaining family positions in rural communities.
I think that's a perfect example of a headline writer who didn't read the article that they were headlining. That was nothing at all of any substance. If that's all you've got to argue about, you really didn't read the article. There was a lot in there about a short-term plan, a medium-term plan, and a long-term plan. And really, it just diverted intellectual effort away from the real substance of that article. So I think whoever wrote that headline probably should be asked to think again about their policies.
Thank you.
Ben Ben Cleary from NTV, do you have a final question?
Hi there. Yes, thank you. The regatta was held yesterday, but people were asked not to attend Kitty Vitty Lake and to watch it virtually. So I guess my question is, for planned festivals and concerts that happen later this month, is it possible to hold those safely?
Probably best for you, yeah.
I think, certainly the majority, if not all of the of places that are planning festivals have developed plans for how they're going to keep people safe and how they're going to, try to maintain physical distancing and having, more outdoor activities versus indoor activities. Most of them have submitted plans and they've gotten feedback on those plans. So, I think there are ways for things to be done safely. In a lot of these situations, the events are largely outdoors, so that's quite reassuring. So yes, I think, we have to think outside the box a little bit, to use an overused term, but we do have to think about how we do things, maybe not do things the same way we've always done them, but, with a little bit of imagination, it's certainly, I think people have found ways to do these sorts of things safely.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us today. I think the take-home message today should be get vaccinated. It helps us proceed. It helps us emerge from COVID-19 on all facets of your life, whether it's in the education system, the health system, getting back to work in a more normal way. So the best thing you can do to help all of us proceed is to please get your vaccines. And on the panel here, we all know the efforts that you've put into at home in getting those vaccines, and that's why we're able to brag about an almost 85% vaccination rate. But please continue to help those who are having problems getting vaccine get theirs, and we'll move faster through all the steps that we need to get back to a normal life. So thank you very much for joining.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada. This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.